Sometimes I wonder if bringing all these new anti-diabetic medicines has caused more harm than good for diabetic patients. Hello all, my name is Onkar and I'm an Indian community pharmacist and I'm obsessed with helping you live better through the knowledge of good. So even though all allopathic medicines are evidence based, my thoughts on this are based on my observations while working as a community pharmacist for past 8 years. I have seen many diabetic patients over 65 years old who have had diabetes for the past 15 or 20 years. They are on only one or two pills or rarely a small dose of insulin, and their random blood sugar is always within 150 and HbA1c is below 7. This level would embarrass many newly diagnosed diabetic patients under the age of 50, whose HbA1c is often above 8 and fasting insulin at value of 13 or 16. So, what are these senior citizens doing right, and where is the current young generation of diabetic patients going wrong? Let's understand this. 40 years ago, newly diagnosed diabetic patients did not have many medicines. Till early 90s, we had drugs like glimepiride, gliclazide, and metformin in India. In late 90s, we got drugs like acarbose and voglibose, etc. If these pills didn't work, we had insulin, discovered around the 1920s, and that was all. Doctors back then mainly advised diabetic patients to control their diet and do physical exercise every day. Those who followed this advice could manage their glucose level really well. In the past, insulin had many side effects. So, patients who wanted to avoid insulin had no choice but to make proper dietary and lifestyle changes. Today, when I hear about the diet and daily exercise habits of our senior citizen who are diabetic, it's almost like a military training. They have been eating low carb food, fiber rich food, and doing physical activities every day, and that's the reason they are physically and metabolically fit. Now, let's look at today's diabetic patients between age of 30 to 50. They have everything from advanced pills to sophisticated continuous glucose monitors to modern insulins. But still, we find number of new diabetic patient is increasing. I think it is because patients have started relying more on medicines than on healthy diet and lifestyle modifications. These medicines give a false sense of security to the patients, making them believe that taking medicine alone will protect them from diabetes and they are free to follow their sedentary lifestyle. Unfortunately, many patients feel that there's a pill for every illness and popping a pill solves the problem. Unfortunately, it is very much far from the reality. Patients who rely only on medicines often suffer side effects. Sometimes these pills stop working after taking it for many years, and doctors shift patient to insulin. Not following proper healthy lifestyle leads to increased insulin doses. It starts from 2 to 3 units and eventually goes up to 18 to 20 units once, twice, or thrice daily. With all this, patients' blood sugar levels constantly fluctuate, leading to more complications like heart problems. And then, along with diabetes pills, heart disease related medication also starts. As a pharmacist, I feel that all these new diabetes pills have done more harm than good. Everyone should stop consuming junk food, alcohol, excessive carbs, and sugar. We should focus more on eating protein and dietary fiber. If you are a vegetarian, protein plus fiber plus little carbs is the best food combination. I believe doctors should prioritize diet and lifestyle changes as part of primary treatment when it comes to diabetes management and keep medicines, pills, and insulin as secondary option. Unfortunately, most doctors do the opposite. When diagnosed with diabetes, the first thing written on the prescription pad is the medicine. So, in conclusion, I would like to reiterate that diabetic patients under the age of 50 do not understand that a diet with low carb and high fiber food followed by lifestyle modifications are the essential things. Otherwise, pharmaceutical companies will keep making more and more medicines, and a time will come when you will have to eat medicines like food and food like medicine. And remember, the alliance between big food and big pharma is harmful to common people. Thank you and take care.